It's funny. Sometimes technology messes up in the most incredible ways. We recently stumbled upon a corrupted transcript from an AI transcription service. And at first glance, it looked like pure chaos, just a random jumble of words. But we had a hunch that hidden inside all that noise was a real, complex message just waiting to be pieced back together. Okay, let's dive into this digital puzzle. All right, so this is what we started with. The AI spit out this long, rambling mess of phrases that feel like they were pulled from a dozen different corners of the internet. You've got YouTube, Sports Illustrated, something about a Verona man. It makes absolutely zero sense. Or does it? And that's the big question, right? It's like being handed a shredded document. All the information is technically there, but it's been scrambled into a million pieces. So for this explainer, we're going to be digital detectives. We're going to sift through this noise, look for the patterns, and see if we can rebuild the original message. So how does something like this even happen? Well, it comes down to the tech itself, automatic speech recognition, or ASR. These systems are trained on just massive amounts of audio data to recognize human speech. But when they run into stuff they've never heard before, like technical jargon or really strong accents, they start to, guess. The AI basically makes its best attempt, often grabbing for familiar words and phrases it knows, even if they're totally out of place. And this is where it gets really wild. Just look at this fragment. It's a pop culture buffet. The Walking Dead, Words with Friends, The Storm Riders. When the AI gets confused by the original audio, it just defaults to what it knows, popular stuff from its training data. But wait, look closer. Hiding in all that pop culture salad. Right there, heart, vessels, and necrosis, which is a medical term for tissue death. And just like that, everything changed. These are not words you'd hear in a conversation about video games. These are medical terms. That was our first huge breakthrough, the moment we realized we weren't looking at random junk, but a corrupted medical lecture. So this is huge. We have a direction now. We're not just staring at gibberish anymore. We're actively hunting for a medical lecture that's buried in here. We're looking for the signal in the noise. So let's see how this new context helps us with the next piece of the puzzle. Our first big, concrete clue comes from this simple, incomplete word, artention. Now, if you think about it, AI transcription often misses the first soft sound of a word. So what's a super common medical term that starts with a soft hey sound and ends in artention? Hypertension, high blood pressure. This one little word fragment acts like our decoder key, setting the stage for everything else. Okay, this is my favorite part. If we go back to that first totally bizarre fragment, we find the phrase Singapore Happy Endings Tippy-Pika Test. It sounds like complete nonsense, but just try saying it out loud, kind of fast. Singapore Happy Endings Tippy-Pika Test. Doesn't it sound a little like gingival hyperplasia, peripheral edema? These happen to be two well-known side effects of a specific class of drugs. This is a perfect example of the AI just matching sounds with zero clue about the meaning. So what class of drugs used to treat hypertension is famous for causing gingival hyperplasia and peripheral edema? Calcium channel blockers. And just like that, from a couple of garbled phrases, we haven't just identified the general topic, hypertension, we figured out the specific subject of this last lecture. We now have the key to unlock this whole thing. Now that we have our topic, we can shift gears. We're moving from just decoding random phrases to actually reconstructing the core message of the original lecture. We're going from finding individual words to understanding the actual concepts. We're rebuilding the body of this talk. All right, check this one out. Again, on the surface, it's just bizarre. The water freezes you, ice cream lemon tree. Seems like it has absolutely nothing to do with medicine. But we have our context now. We know the lecture is about calcium channel blockers. So what on earth could this phrase possibly mean? Let's try our little phonetic trick again. Say, the water freezes you, and just listen to the sounds. What if the original speaker said the word vasodilation? The sounds are actually surprisingly similar if you kind of squint your ears. And vasodilation, the widening of blood vessels, is the primary way these drugs work. The AI heard a complex medical term and just substituted a poetic but totally wrong phrase that sounded kind of the same. So let's quickly put together what we just figured out. Calcium channel blockers do exactly what their name says. They block calcium from getting into the muscle cells in your blood vessels. This makes the muscles relax, which causes the vessels to get wider, that's vasodilation, which in turn lowers your blood pressure. A pretty complex mechanism, accidentally described by the AI as the water freezes you. Incredible. And if you had any doubt, just look at this next piece. Here, the AI got so tantalizingly close, it heard calcium channel almost perfectly, but then it translated the rest into mirror force vector for this format, sell endless fun. It's like the AI understood one piece of the puzzle and then just filled in the rest with complete gibberish. This pretty much confirms, without a doubt, we're on the right track. All right, so any good medical lecture about a medication is going to spend a good chunk of time on the potential side effects. Now that we're dialed into the main topic, let's see if we can decode the parts of the transcript that we're probably talking about those adverse effects. And here's another fantastic example of the AI hearing phonetics instead of meaning. The transcript says, use our face waxing effectiveness. It's a weird phrase for sure, but think about the side effects of a drug that widens your blood vessels. A really common one is facial flushing, where your face gets red and warm. The sounds? Almost identical. The AI just picked the wrong set of words from its database. Now this next one. This one might be my favorite because it contains a direct contradiction. In one breath, the AI gives us Korea butter body, and in the very next, it says the heart is beating fast. So, which is it? How can both be true? Well, they can't be. Korea butter body is almost certainly a scrambled attempt at the word bradycardia, which means a slow heart rate. And of course, the heart is beating fast is tachycardia. The only way this makes sense is if the original speaker was comparing two different types of calcium channel blockers, one that can slow the heart and another that can speed it up. The AI, having no context, just smashed these two opposite ideas into one impossible sentence. So let's just take a step back and look at what we've done here. We started with what looked like total digital chaos, and piece by piece, just using context and a little bit of phonetic detective work, we've basically reconstructed a coherent, complex medical lecture from this ghost in the machine. This table really just summarizes the whole journey. We went from art attention to hypertension, from the nonsense of Singapore happy endings to actual medical side effects, from the water freezes you to the concept of vasodilation. We successfully managed to translate all that noise back into a signal. What this whole thing really pulls the curtain back on is a fundamental truth about AI right now. It can process language at an incredible scale, recognizing phonetic sounds with amazing accuracy, but it doesn't understand. It doesn't have the medical knowledge to know that vasodilation makes sense in this context and the water freezes you doesn't. It just matches sounds to the most common patterns it knows. And this really highlights a uniquely human skill. We have this amazing ability to infer, to use context, and to hold a bigger story in our minds that lets us piece together broken information. This whole thing wasn't really about the AI failing, it was about the resilience of meaning. It shows that even when a message gets completely mangled, a curious human mind can usually put it back together again. So I'll leave you with this question to think about. We're relying on these kinds of translation and transcription tools more and more every single day. In medicine, in law, everywhere. As we keep weaving this powerful but obviously imperfect technology into our lives, how do we build the checks and the critical thinking skills to make sure we're hearing the message that was actually intended, and not just some scrambled echo from a ghost?